Health savings accounts are awesome savings vehicles because money goes in tax-free, it grows tax-free, and it comes out tax-free so long as the dollars are used for healthcare. But if you're working past age 65, you have to understand a few technical rules to avoid making ineligible contributions which could be subject to taxes and penalties. Today we're talking about the so-called HSA Medicare Trap. Stick around. Now, when it comes to the HSA Medicare Trap, there's a few different ways that people can get caught, and I've seen this happen with several of my clients. So this is a video I've been planning to get out there, wanted to get out there to help others try to avoid this issue. So the main problem is to be eligible to make an HSA contribution, you have to have a high deductible health plan. However, Medicare is not considered a high deductible health plan, and therefore this can be problematic for people that are working past age 65, which of course is Medicare age. Now, it gets particularly confusing for those working past Medicare age because it's very likely that you're still covered under a group or company sponsored plan. But what frequently happens, specifically with smaller businesses with less than 20 employees, is once you turn 65, your employer is likely going to tell you to enroll in Medicare Part A, even though you're still covered by the company plan. So the issue is you might think that because you're still covered by a company plan that may be high deductible, that you can continue to make HSA contributions. Unfortunately, once you enroll in any part of Medicare, including Part A, which is the hospital coverage, no premium, once this occurs, you become ineligible to make HSA contributions, again, even though you are covered under a separate high deductible plan. This is one of the ways that people get caught in the HSA trap. Now, the second issue, and this is probably what catches the most people, is the fact that Medicare coverage is actually retroactive by 6 months if you're enrolling after you've already turned 65. So for example, let's say you worked for a large company until you turned 66. Meanwhile, you're making HSA contributions along the way, all the way until you're retired. The problem is when you retire at 66 and apply for Medicare, that Medicare coverage actually is retroactive for 6 months. And therefore, all the contributions that you've made in the most recent 6 months are likely to trigger the HSA Medicare trap. And unfortunately, in my experience, there's few HR departments that are very proactive in telling people to watch out for this issue. And frankly, I'm curious, if you're watching this video and you're someone who is working past 65, have your HR people or has your company, whoever's running the health plan, have they told you about this issue? Leave me a comment. I'm just kind of curious what your experience is with this. So if you're working past age 65 and you want to continue making HSA contributions, you can, so long as you're not enrolled in Medicare Part A, and in addition, you're also aware of the 6-month retroactive Medicare coverage, and therefore you can act appropriately to make sure that you stop well in advance of your retirement and therefore don't get caught in the HSA Medicare trap. Look, thanks for watching today. Do me a favor and hit the thumbs up button if it was helpful. It really helps get the message out there. And I hope we'll see you in the next one. Thanks so much.